So with stem cell transplants, one of the probably the most common side effects, especially because of the conditioning regimens we use, is diarrhea. And we also have to balance out the fact that some of our diarrhea samples will come back positive for things like C. diff that can have issues that can cause issues like toxic megacolon and can be quite severe for the patients. So what we wanted to do though, however, because most of our patients actually have negative stool results, so the idea was to start. So the current practice was patient has diarrhea, they give us samples, we wait for results, and we then start loperamide if they're negative. But we wanted to try, we'll send samples, we'll start loperamide, and then if they come back positive, we'll just stop it. And then start the correct treatment. So that's what we did. We implemented this around about 2020. So the study was collection of data before we implemented it and compare it with the data after we did the change. And what we found was that there was a significant reduction in the amount of time that patients had diarrhea for. And we also found that it had a good impact on the length of stay that the patients are coming in for the stem cell transplants. And out of our whole patient cohort, which was about 99 patients, we only had about 3 patients that had an infection. And even though we started loperamide and we stopped it, there was no adverse events from that. So we proved that it was safe and it clearly benefited the patients. And at our trust, we presented it to governance, and this is now fairly standard practice. So this was started off in the ambulatory care unit, but that is now standard practice in our inpatient unit as well. And it's clearly benefited the patient. It's done really well.